Thank you, everyone. Welcome this evening to the New York State Child Care and Development Fund draft plan for fiscal year 2025 through 2027. I'd like to introduce Nora Yates, who will be speaking this evening.
My name is Nora Yates. I'm the Deputy Commissioner here at the Division of Child Care Services at New York State Office of Children and Family Services. I'm very thrilled to have so many people signed up to testify and participate in this public hearing. We know more folks will be joining in, but first and foremost, we wanted to say thank you to all the child care providers and early childhood educators who are on, because it is Child Care Provider Appreciation Week, an official day on Friday tomorrow. There's several things going on this week, both locally and statewide, but we just wanted to take a minute because we know several of you are here to thank you for all of your hard work. Thank you for all of the support for children and families that you do every day, and the work that you do is so critically important to our state. So thank you, thank you, thank you. So not only do you do this very important work every day, but then you come and you hang out with us. And so I really appreciate you coming to, appreciate everyone coming to the hearing tonight. We can go to the next slide. So just some housekeeping before we jump into the nitty gritty. We have a short presentation to walk through the Child Care and Development Plan that is to be discussed tonight. And then, so we'll do a walkthrough of that plan, and then we will open it up for testimony from people who signed up to testify. We are doing simultaneous interpretation. So when you are testifying, just to remind you to try and speak slowly and clearly so that our interpreter, Andres, can make sure that everybody can hear you and understand your testimony. So appreciate that. When it does come time for your testimony, we will be allowing for folks to be unmuted and on camera. If you're interested, you don't have to be on camera. But right now, everybody's muted, and then we'll open it up when it's time for the public testimony. Also, later at a certain point, we're going to switch over. There are several people who are testifying in Spanish. So we're going to ask and give you instruction on how to do that switch of the language on your computer so that everybody can testify. So that's the housekeeping. Sorry, I have something in my throat, of course, before I present. You can go back one slide, Kathy.
I'm sorry, Nora, can we pause a moment?
Yeah.
We can't hear the interpreter, so we're doing some troubleshooting.
Oh, okay. Yep, so before we proceed, I want to make sure everyone can hear Andre. Always some technology fun at the beginning.
Thank you so much for your patience, everyone. We may have to have our interpreter sign off and back on. We really want to make sure that everyone can hear. Thank you so much for your patience. Andreas is signing off and back on, so hopefully that will resolve the issue. So thank you for your patience. It'll just be one more moment. Thank you so much for your patience, everyone.
Any luck? Kathy?
We're getting there. He did leave and come back, and we're just testing to make sure we can hear him.
Yes, Andre, I was able to hear you. I think we're okay,
Yep,
Nora.
I could hear you. Yes, I
Excellent.
can hear
So
you.
we can resume.
All right, great. Andres, thank you. Thanks everybody for making sure WebEx is not our favorite, just not our favorite. Okay, so brief presentation and then public testimonies. So just a little bit of background on the block grant, which you've all read probably multiple times, but the block grant was passed in Congress on 2014. There were 2 sets of regulations that were issued to implement the block grant in states, one in 2016 and then most recently, excuse me, in 2024, and we'll talk about that most recent one. The CCDF program is an $8 billion block grant, but it is one of 4 funding sources of the child care ecosystem in New York. So our allocation is $582 million out of the New York total child care budget of over $1 billion. So this is one of 4 funding sources in New York. It does encompass our entire system, though, because there are 4 funding sources. It is all our entire system is compliant with the rules of the Child Care and Development Fund. There are no separate kind of streams due to funding sources. Okay, you can hit the next slide. So the goals of CCDF, and I'll say CCDF, but that's the Child Care and Development Fund. The primary goal is to inform parents and the general public about child care choices and promoting parent choice, assisting states in delivering high quality child care, raising the standards for health and safety, and increasing the number of low-income children in high-quality settings. You can go to the next slide. So the Development Fund provides resources. Ooh, you can go one more. Sure, let's go with this one. So the plan that we're talking about tonight is an agreement between the lead agency, which is OCFS, and the federal government about how we will be implementing the rules here in New York. So in New York, OCFS is the lead agency, and this plan that we're discussing tonight is the document that we transmit to the federal government on how we're compliant with the federal rules. You can go back one. Okay, good. So the one we're presenting tonight is how we'll comply with those rules. So we have to submit a 3-year plan every 3 years. The plan that we are submitting in July is for the period of 2025 to 2027. We are currently in the 22-24 plan, obviously. So if you're curious and want to read the current plan that we're operating under, everything is posted on our website, both the development of and current version. You can hit the next slide. So the timeline for the plan is right now we are here in May having the public hearings, and then there's another public hearing tomorrow, and then public comments are due by May 22nd. So after these hearings and people submit their testimony, we'll review all of the testimony and update the draft and update the plan version. We're going to talk about the final rule in a second, but that's those new regulations that just went into effect. And then June, we'll kind of compile all of the stakeholder feedback and final review, and it's due to be submitted on July 1st, and it goes into effect in October. You can hit the next slide. So the 2024 final rule. So this was the most recent regulations that just went into effect on April 30th, just like a week ago. So these new regulations are focused on a couple different things. They are about lowering child care costs for families, improving payment practices to childcare providers, increasing options for childcare for families, making the enrollment in the childcare assistance program easier, and then giving clarity to kind of the larger childcare development fund regulations. So throughout the presentation tonight on the plan, there's several pieces that are relevant to this final rule that I'll highlight for you as we're in those sections. For example, one of the final rule requirements is about lowering family copay in the child care assistance program. And so that's a requirement that states have to have the copay no more than 7% of a family income. And I think many of you or most of you know that New York's copay is at 1% right now. It was changed last fall, and so it's 1% across the state. So we'll highlight those final rule components in the different sections as we go through. You can hit the next slide. All right, so there are 10 sections. I'm going to go through each one just to kind of walk you through the purpose of the section, what is in the OCFS or New York State response to those questions, and then, like I said, highlight any final rule or kind of new information since a week ago that's in that section. So there are 10 sections. I'm not going to go through every single question of every single section. Much of the questions are the same year to year, but I will update and indicate where those answers are different or include new information. But we want to hear from all of you, so we're going to give you an overview, a chunky overview, and then be able to have time for the public testimony. Okay, so we're going to jump in with section 1. And hit the next slide. All right, so section 1 is about how the entire CCDF program is administered. It is specific to 3 questions, which is the CCDF leadership in the state, who has the policy decision-making authority in the state, and then how the state has consulted with specific required entities in the development of the plan. So, for example, in New York, we are the lead agency, and the specific entities that we are required to consult with the plan include the New York State Early Childhood Advisory Council, which is the ECAC. That is a statewide council that is appointed by the governor. It is administered by a sister agency, the Council on Children and Families, and has several state agency appointees as well as community and provider appointees. They meet quarterly. All that information is available, and we have presented the plan structure and solicited feedback and engagement with the ECAC. We also are required to consult with our fantastic child care resource and referral agencies, also called the Child Care Councils. We partner regularly, but also formally with the tribal nations that border the state. And then there's other required entities. You can hit the next slide. So section 1 doesn't have a lot in it, so I'm going to jump into section 2. Section 2 has 5 questions. It's really focused on eligibility, enrollment, and continuity of care. So the first 2 questions are really about reducing barriers to family enrollment in the child care assistance program. So this section is very specific to the child care assistance program. In New York, it's CCAP, but other states call it subsidy or the subsidy program. And then 3, 4, and 5 are related to serving vulnerable children and families or families experiencing homelessness with the child care assistance program. So you can hit the next slide. So 2.1, just to highlight a few questions. So 2.1 is about reducing barriers to family enrollment and redetermination. One of the things that the final rule included, and New York is actually already doing, which is leveraging other social service benefits to make the enrollment in childcare easier for families. So if a family already has SNAP or food stamps, effective October 1, 2023, that information, that financial information can be leveraged to make the enrollment and eligibility determination easier for that family. So it is in New York currently it's SNAP and HEAP, but we are looking at additional programs or public benefit programs to be able to make it easier for families. The other thing that was included in the final rule, which is around how families apply for childcare, currently in New York, outside of New York City and Schenectady County, people apply using a paper application. So we will be launching online soon a child care assistance application. And by soon, I mean just a few weeks, so not months. And so this will allow families to be able to streamline the application process and then upload information. You can go to the next slide. So 2.3 pivots to prioritizing services for vulnerable children and families. And this asks about how the state does that. How does the state prioritize services? And so for those of you in or unaware or probably aware that in 2023, social services law was amended to authorize OCFS to establish statewide priorities about which populations the state wants to prioritize in terms of being eligible for child care assistance. And so previously, those priorities were determined on a local level and they varied across counties. It was very unstable. I think for child care providers, it was very unstable. For families, it was very unstable. So last year, we were able to do away with that and be able to establish state priorities. And so on this slide, you'll see 1, 2, and 3. Next slide, it continues on what those state priorities are, such as families between that 300% of state income and up to 85%. Also, families who have an open child protective or preventative case. Families in need of child care for a child who's been placed in foster care. You can go to the next slide. And then the priorities are continued, families with a teenage parent in need of child care assistance, so the parent can go to a high school or equivalency program, families in which the caretaker is receiving services for victims of domestic violence, and then families where the child caretaker is participating in an approved substance abuse treatment program. These are statewide priorities across the different districts. We can go to the next slide. So the final rule, I mentioned that I would be highlighting this throughout the presentation about how the final rule affects that section of the plan. So there's several things in the final rule that are about ensuring that our eligibility policies minimize disruptions to families. And so in the final rule, it talks about preliminary eligibility. Also in New York, that's called presumptive eligibility. And so that doesn't require that states offer it. It clarifies that information, that states are allowed to do it and use federal funding for it. It is an option right now in New York that districts can do preliminary eligibility. There is currently one district that is doing preliminary eligibility. It is Delaware County. And so that is in New York, at least in one district. It's a relatively new option. The final rule wants us to leverage eligibility from other public assistance programs, which we're doing, coordinating eligibility determinations for children in the same household. So what that means is if there's a child who's already receiving child care assistance and a new child is born or comes into the household, that the eligibility window stays the same. So that first child eligibility window would change to whatever the eligibility window is for the new kid. And launching a screening tool for families. We do have an online screening tool for subsidy, as well as, like I mentioned, we revised the child care assistance application and launching an online version. You can go to the next slide. Okay, going into section 3. Section 3 has 3 questions, but they are all very important questions. It is specific around affordability and looking at co-payments. Go to the next slide. So it looks at what the family co-payments are, how they're calculated, and in what populations or scenarios does the state waive co-payments for families. So as you all know, that the state and the governor have taken a number of steps to lower costs for families receiving child care assistance. Last year, effective October 1, the family share or the family co-payment was set at 1% of income exceeding federal poverty level for all families. Only those families also who are required to pay a family share. There is several groups of families who are not required to pay a family share. So previously, districts were allowed to set a family copay or family share, so it varied again across districts. This provides consistency for families, consistency for providers, and also lowers the cost because it's 1% across the state. We can go to the next slide. Okay, so Section 4 has 5 questions. It is looking at parental choice. As I mentioned, the goal of CCDF is focused on making sure that parents have all the choices of childcare available to them, whether they're participating in the child care assistance program or subsidy or not. This is specific to the subsidy, or child care assistance program. So this is looking at parental choice for the families participating, that those families have equal access, and then what the payment rates and payment practices are. You can go to the next slide. So 4.1 and 4.2 is assessing that full range of provider options and also the market rates that our states are required to set. So for background, for those who are unaware, the CCDF requires that states use a market rate survey or an approved alternative methodology is what they call it, or an approved different way of setting rates for their child care assistance program. And so we have conducted market rate we've always conducted market rate surveys. So we include information here on both the 2017 and the 2021 market rate surveys to compare to the most recent market rate survey, which was completed in the fall of 2023. Now, to confuse things, this section is written in two ways. There are new market rates that are going to be announced shortly based on that 2023 data that that is being analyzed now. So this section and these answers kind of go both to our previous market rate survey and to the one that's coming up. And I apologize that that's confusing because remember, this plan goes into effect in October. So we had to write it as if those new rates were already in effect. And so that's why it bounces around a little bit in this section. If you were confused, me too. So the first thing that I wanted to highlight was specific to barriers for provider participation in the child care assistance program. And so we compared the responses of providers to whether or not there were barriers to participating in child care assistance. So only 14% of providers reported that payment rates were too low in 2023 compared to 40% of providers in 2021. And then in this last survey, only 7.5% of providers reported not being paid enough for absences in 2023 versus in 2021, it was 32%. Many people are aware we've also updated the policy around absences, and New York currently pays for 80 absences per child per provider per year. So we believe that change really did improve the response for providers about how they interact with the child care assistance program. You can hit the next slide. So 4.3, 4, and 5 are specific to how the state evaluates whether those market rates, which we are required to do that survey, are adequate, and what the payment practices are for providers. So again, this is all around child care assistance only. This is not kind of the more global private pay child care market. So whether or not those are adequate payment rates, currently, I'm just going to go to the second paragraph here. In federal fiscal year 2023, 71% of children who received child care assistance were in licensed registered settings, and 29% were in enrolled legally exempt care. And so in our system, our entire system in the state, 70% of licensed registered providers cared for children in receipt of child care assistance. So that demonstrates that families do have equal access to a broad range of providers, over 70%, the majority of providers. And then in terms of supply building and adding additional rates for particular populations or services, in New York, our local social service districts must pay a differential rate or an additional rate for providers who offer non-traditional hours or hours outside of kind of the window. And that goes above the existing rate. And then they also, districts can choose to set a higher rate for other differentials or other populations. So we know that several differential information or several differential statute or changes were made in the most recent governor's budget. And so because those just went into effect, we'll be updating the plan in the fall and amending the plan to reflect those new differentials. So for those of you that are unaware, the governor announced to add increased differential to drive quality in high quality settings. And so providers who participate in being accredited or participate in Quality Stars would be eligible for a higher rate for those children being served by Child Care Assistance Program. So those changes are coming in the fall, and then we'll update the plan from there. See how fun of a process this is. All right. I'm just being mindful of time. So Section 5 is actually where we shift to the entire child care ecosystem. So this moves on beyond just the child care assistance program and this section applies to all child care settings, whether or not they have children with child care assistance. So Section 5 focuses on health and safety requirements that are required by the federal government and are required for states to implement, like licensing and ratios and standards, as well as orientation, pre-service training, and monitoring and enforcement, ongoing training, and everybody's favorite topic, comprehensive background check. We can go to the next slide. It might be Section 6 even. Yep. So just on Section 5, I didn't spend a lot of time on Section 5 because there were not really any changes relevant to the final rule requirements in Section 5. And a lot because New York State has almost all of our health and safety requirements in regulation. The answers in Section 5 are the way that we answer Section 5 are our regulations. So our ratios are in regulation. Our health and safety and training requirements are in regulation, and how we implement all of the requirements around training is in our regulations. So that's why Section 5 didn't have kind of a bullet, because it looks very close to previous year's section. All right, wait, go back to Section 6. We love Section 6. Great. Okay, so Section 6 is focused on workforce. So it looks specifically at supporting the workforce and also professional development and training opportunities. It also includes information on the early learning and developmental guidelines. And so our responses here outline OCFS's and our partners' efforts to support the child care workforce, how we implement a professional development framework. So what are all the different pieces of professional development that are available to child care providers in our state, and then the early learning and development guidelines that exist and how those are being distributed. Our responses include, I just realized how many acronyms are here. which is our partnership with the Professional Development Program, and the ECETP, which is the Early Childhood Education and Training Program, which many of you refer to as PDP, or you may know about the EIP program, the Educational Incentive Program. And so the support, the funding for that program, as well as the variety of free trainings available for providers and also for regulators. The workforce development website that OCFS developed and our partnership with the New York State Department of Labor, as well as our support for the Early Childhood Career Development Centers, which is administered by CUNY PDI, who also administers the Quality Stars program. You can go to the next slide. Section 7, it is specific to quality improvement activities. There's a component of the federal grant that is called a set-aside, and so the state is required to set aside a portion of funds specific to driving quality. We are very fortunate in New York that there are several quality initiatives that we support and our partners support, and there's several quality initiatives that our providers are involved in. One thing we wanted to highlight here was current assistance that the Division of Child Care is receiving from the Federal Capacity Building Center, which is focused on an impact project. And so the impact project will work to create a definition of quality childcare within the state. We know that there are Quality Stars and the Quality Stars ranking and improvement system. We know there's accreditation through New York AEYC or Family Child Care. But what we don't have is a kind of common framework for all of the programs that are licensed and registered. So there's some programs who are accredited, some are in Quality Stars, some are in Family Child Care accreditation, but really wanting to create a way that all programs and all providers can access both an understanding of quality and then what supports providers may need to improve on that quality. So we're working on this impact project. I think you've probably seen some materials about it. It is a 2-year-long process, so you're going to hear a lot about it, and we appreciate all of your help and engagement. Also included in this section around quality is around investments in the pyramid model, investments in the epinephrine auto-injector, initiative, as well as Quality Stars and our training program. Excuse me. I can't do this when I'm talking. I can't have this when I'm talking. You can go to the next slide. All right, section 8. So section 1 was around partnerships, and that was specific to the development of the plan and who we partnered with on the development of the plan. So section 8 is about who we partner with and coordinate with on an ongoing basis to support service delivery. So this looks at the partners to expand accessibility. It looks at the different use of funds and how funds are combined. It looks at coordinating with our child care resource and referral systems. We've got an amazing system in New York. We're very lucky. And so it talks about working with those CCR&Rs or child care councils. It works on some of the public-private partnerships that we have had, both with Robin Hood and others, and looks at our disaster preparedness response plan, which is coordinated with a lot of the disaster response entities throughout the state, both local and statewide. This also includes information on that Early Childhood Advisory Council and how the coordination happens there. Our partnership and our ongoing collaboration with the tribal nations that border New York. There are 2 tribal nations who also are lead agencies for their own CCDF grant, and so we have kind of more partnership with those 2 tribal nations that border New York, and then also have at St. Regis Mohawk, Akwesasne, we have licensed programs and coordination as well. So we're very grateful to have kind of all different structures for tribal nations that border New York. We obviously coordinate ongoing with our Head Start collaboration director and the Head Start programs, as well as the local and state public health authorities, the state education department, and the state coordinating entity for the CCR&Rs, which is the Early Care and Learning Council. Lots of partners. We can go to the next slide. I'm almost done, you guys. We're on 9. You're doing great. So section 9 is on family outreach and consumer education. There's very specific requirements on the federal level for how states present information for families and have access for families to give feedback or provide complaints. So it asks for details on what the parental complaint process looks like for New York, what the consumer education website or the OCFS website and the information that's on OCFS website, which includes information on providers, on parent access, also other resources that parents need access to, you know, how to get SNAP or apply for public assistance or Medicaid, how we work on increasing engagement and improving access to that information. And then also specific in this section is on how we provide information on developmental screening. So these responses focus not just on the website and the complaint process, but also resources on social emotional health, preventing suspension and expulsion, and distributing developmental screening information. All right. So section 10, last section. I said it would be brief. I think we're trying. So section 10 is around program integrity and accountability. So section 10 is on the federal government is asking the states how you are ensuring accountability of our fiscal agents. In this case, it's the local social service districts and also providers who accept child care assistance. So a lot of these internal control questions are related to child care assistance. So what our internal controls look like, what our fiscal management structure looks like and tracking, as well as fraud investigation, audits, and recovery. So it is not just child care assistance, but it has a lot of discussion and details about how that works between the state and our local social service district. There we go. Fantastic. That was section 10. All right, everybody stretch. We are going to move into testimonies. We had a great number of people sign up, which is fantastic. Thank you so much. So what we're going to do, and Jared and Kathy can correct me if I'm wrong, but what we're going to do is everybody's muted right now. You'll be changed to a panelist so that you can unmute yourself, right, Kathy?
Apologies, I tried to unmute myself and instead I advanced the slide. Yes, so what we're going to do is we will be promoting you to a panelist in order for you to speak. And if you choose to, you can turn your camera on. You'll see a little camera button likely at the bottom of your screen. If you click on that, that will turn your camera on if that's available to you and if you so choose to. We do have one person who is speaking tonight who is Spanish speaking. So they will be providing their testimony in Spanish. If you would like to hear the English translation of what they are saying, our interpreter Andreas will be interpreting what they are saying into English. If you'd like to do that when it comes their time, I will remind you of this, but what you'll need to do is you will actually need to move yourself into the Spanish room. So how you will do that is you will click on the little globe icon that you will see likely in the bottom left hand of your screen. This is available on computers and laptops. It may not be available if you are calling in from your phone. But if this is available to you and if you would like to hear their testimony in English, you can absolutely do this by clicking on that globe icon, choosing the Spanish room, and then adjusting your balance either to the left, you will only hear the Spanish, all the way to the right, you will only hear the English, and in the middle, you'll hear both English and Spanish. So it is really your preference. Okay. So I will go ahead and advance the slides here.
Yeah, so our first, we do have a timer on here just to make sure everybody can get a chance to speak. I will gently remind you when your time is over, but appreciate everyone sticking to, around 5 minutes, 7 minutes. And then we appreciate everyone's patience too, because some folks either signed up and then weren't able to make it, or if there's technology issues. On our last hearing, we had folks who had to shuffle around so that we were able to hear them. So we appreciate everybody's patience. I know you're all patient. But our first testimony is coming from Markia McCullough. And Markia, if you are available, that's great. Looks like you're promoted, so the floor is yours.
Well, I'm not going to be too much in the camera, but good afternoon, everyone. I wanted to come on and just say, as far as the, we discussed in, I believe, slide 10, the, how do you, it was so much information. How do they monitor the results of the child care agencies that you partner with, and the families and the providers? That's a big thing for me because I've been on all sides of the fence, and it's not a real easy program. I would like to see that the program is easier for our clients to apply. I would also like to see that I've been legally exempt, and I just got trained for group. So on the legally exempt side, you go through the Child Care Council, and you are, it's a whole process, but the process was not easy. And I was kind of treated like the client. Even when it was time for my client to submit documents, the process took about 6 months. So the client lost her job. Um, there was a lady from DSS that was handling the case, Miss McCormick. I was the provider. I still kept keeping the child because the mom was going to school. She was going to work every day. So she was working and going to school about 12 hours a day. But I didn't get paid for every hour, but I still kept the child. But none of it was counted because of paperwork. And I would like to see that process easier. I know we only have a few minutes here. Also, with the Child Care Council, um, for some of the months, I wasn't paid, and the client was eligible, and I was eligible as well. Um, I took it to my counselor person who handled it was Pam and Linda, and it was just a long process. It got it it was a very sticky situation. I just would like to see the process a little bit easier for families. I don't know who's monitoring over these agencies. Making sure that the rules are being applied, or if there's a Q&A for clients, or is there a place where they can actually submit information. So when you have these 3-year you have to re-register again for for the federal government, that they will have this information. How would someone go about monitoring that or submitting that information? Hello?
Yep. Markia, I don't know if that was there you are. I don't know if that was a question or a comment.
So that's a question. How would you go about submitting that information? How do they regulate that? Far as how are the clients getting this funding? Are they being treated well when they're getting the funding? How is the process? Is anybody regulating that part? Are the providers, how is the process for the providers? On the state level, you guys seem to have it down pat. But far as when we're in the field, it's not as easy and smooth as we just did this meeting, how you just went through that meeting like that. And it's not that easy and smooth on this level where, it really counts. So I wanted to know, is there a process, or is there a place where providers or clients can submit these submit some type of inquiry about these agencies? Question. That's a question.
Yep. Yep. So technically, this is an opportunity to do a public testimony, so it's not kind of open question. I meant to say that at the top. But Markia, that's a good question, and we will take it back and make sure to include information in the plan that shows how we are monitoring or how we require the local, CCR&R or others to do that monitoring. So there is some, but what I'm hearing is possibly you're thinking that there could be improvements there.
Yeah, I just want to know if there is some, can we know about them? Like, is it public information or is it just private, or how do you find out about it?
Yeah, it is public. So we can definitely distribute that information. Absolutely.
Okay, I'm sorry. I didn't know it was just when you said testimony, I just thought it was like weighing in on these topics. I do apologize.
No, you're fine. You're fine. I just didn't want to, I just wanted to level set what the, how much we can offer information. Like I don't have all that right now.
Right.
But yes, we will definitely include that information. And thank you so much for speaking.
Yeah, I've been on every level, far as social service, fighting for the client to get these services, also dealing with child care counsel. I think the most easiest one was OCFS, but they didn't give me any trouble. But on every level, on this lower level here in the communities, it's totally hard for these families to get this money or to get this funding. Not even the money, just the funding so they can go to work and pay for childcare.
Mm-hmm.
Thank you for having me.
Thank you. Thank you so much. Right. Emily, I think you're up next.
Hi, can you hear me?
Yes, we can.
Okay, perfect.
Yep, thank you. Go ahead.
Okay. I have a few topics. Those who have heard me before, these are not new, but I'm going to run through them really quick. So section 5.2, I wanted to make a comment about the description and definitions for infants, toddlers, and preschool students. Our group, the Daycare Owners of New York State, believe that they should be the same definitions as infants, toddlers, and preschool students. Are talking about the same group of children, and they should not vary between modalities and locations within the state. I'd also like to talk about section 9.1, the parental complaint process. I know that it's saying that lead agencies are not required to limit the complaint process to parents, but I really think that there should be some kind of a process that vets the people who are trying to submit complaints. There's been some examples of competing daycares or some completely unassociated people with just grudges against people that own or work for daycares that are submitting bogus complaints, just to kind of use the system as a damaging weapon instead of what it should be used for, which is to protect the health and safety of the children enrolled. Section 9.2 about the consumer education website. I, again, would like to state that unsubstantiated complaints should not be posted here. Just like any criminal who is charged with a crime, if and when it is unsubstantiated or they are found innocent, it does not stay on their record and should not be on ours, and certainly not made public, since it is basically moot and has been investigated and determined unsubstantiated. So I think that those should be removed. I had a statement on page 149 of this document. It mentioned 4 years of compliance history would be available to the public. There was a slideshow that Nora presented at the end of March, I believe, that it was said that it was going to be reduced to 3. So I had a question as to why it mentioned 4 years if 3 was documented in March. And then on page 150, monitor and inspection reports, where it states that they are in plain language and the OCFS documented. Yes, I disagree immensely with that. I don't think it's in plain language. There is lots of social media posts where parents are terrified of daycare centers specifically because of what has become our rap sheets on the OCFS website. The context of the violations rarely match the description of what is visible, and they often look significantly more egregious than they were in reality. And I'm hoping that we can get either more context in the compliance history or maybe just some clarification there. I don't think it's in plain language, and a lot of parents really are starting to fear childcare providers, specifically in a formal setting, which isn't necessarily fair in most cases. And there was also in the same PowerPoint from March, there was some discussion about how the OCFS also agreed that plain language needed to be improved in the compliance reports. So I guess I was a little bit confused as to what they thought was changed enough to answer yes to that question, or if yes was just marked to be compliant with the funding requirements, which seems unethical. So those are my comments.
Sorry, I'm writing, and thank you, Emily.
Thank you. So we're going to skip ahead. Kyron and Charisse are not currently present, so we will skip ahead
To Ramon, is that right?
to Ramon. Yes.
All right. Oh, hi, Ramon.
How you doing, Nora? Good evening. My name is Ramon Peguero. I'm the president and CEO of the Committee for Hispanic Children and Families. Thank you for the opportunity to offer comments on the New York State CCDF plan. CACF is a not-for-profit organization with a 42-year history of combining education, capacity building, and advocacy to strengthen the support system and continuum of learning for children and youth from birth through school age. As a member of the New York City Child Care Resource and Referral Consortium, we continue to value the partnership between OCFS and the CCR&Rs across the state of New York, collaboratively supporting statewide efforts to increase the quality and affordability of childcare and preschool, which is an essential need for family stability and child development. In the interest of time, I will be focusing my comments here on some specific points pertaining to equitable support for the childcare workforce and families, but refer to our full written comments. On presumptive eligibility, the CCDF final rule encourages states to consider all children, not just those experiencing homelessness, presumptively eligible for child care assistance prior to full documentation and verification. Of significance, the new federal rule states that CCDF dollars may be used to cover the cost of the presumptive period if a family is ultimately deemed ineligible. While we commend the fast-track options for families deemed eligible for SNAP and HIP, all other families are subject to processing wait times of up to 45 days. Contrary to helping families in starting and maintaining employment or their education, this poses potential harm to the family's stability. States that have implemented a presumptive eligibility policy have not reported large costs as a result. This is also notably true in Monroe County here in the state of New York. We urge that presumptive eligibility backed by CCDF funds become mandatory statewide to ensure consistency and equity across the state, with guidance on agencies' best practices to ensure high likelihood of family eligibility, reducing barriers to family access. We continue to align with our partners in the Empire State Campaign for Child Care in calling on the state to do all it can to eliminate all exclusionary barriers where the federal government has made allowances. This includes removing minimum number of hours in eligible activities for families to qualify, and a discontinuation of limiting authorized child care services strictly based on the hours of the eligible activity. This is not only critical for families who are trying to maintain stability, but for children who deserve access to it and develop best in consistent schedules and care spaces. We continue to focus as far as outreach on achieving true equity in access with continuity improved method of outreach and education around childcare support options, particularly to exceptionally vulnerable, historically underserved, and hard to reach communities. We appreciate existing towards that end and want to ensure that we are eliminating language barriers to the fullest extent possible, particularly for the top 12 languages. For the OCFS website where Google Translate is used, there should be a simple note at the top directing families to OCFS translation services in case they find the content of the full website confusing. Further, within the context of serving families experiencing homelessness, there should be regular evaluations of shifts in and arising barriers to access within these demographics. For example, the state should offer guidance or support to LDSS regarding recently arriving migrant families in shelter, ensuring that families are made aware of any childcare options for which they might be eligible. Provider payments. The market rates continue to be based on false data, not true cost of care. High quality simply costs more than base level quality, and underfunding subsidies for providers is disproportionately harmful to low-income communities. CACF recognizes these gaps in funding and resources as early beginnings to educational inequity trends that follow many of the children served through pre-K to 12 systems and beyond. Payment practices. We must ensure that providers serving children with subsidies are being paid the same as private paid programs, prospectively based on enrollment, not through reimbursement by attendance. This must be a statewide practice to ensure consistency and equity across the state. Additional support in the workforce. New York State must invest beyond one-time COVID dollars to ensure stability of the sector. For example, building off the workforce compensation and recruitment grants towards a permanent compensation fund to ensure that ECE workforce are receiving competitive wages. Currently, the burden of undercompensation falls on the shoulders of the private pay families, or more often on the shoulders of the providers and the program staff themselves. As a result, this workforce, made up of overwhelmingly by women, women of color, and immigrant women, remains some of the lowest paid in the state, earning less than 96% of other occupations statewide. We appreciate the resources compiled by OCFS and its effort to remove the language barriers. We continue to underscore the importance of making critical resources for the childcare workforce available as directly translated document. This includes licensing and orientation materials, professional development and training resources, and resources to address challenges with mental health and staff recruitment challenges. In closing, I wish to reiterate our appreciation of the thoughtful partnership and collaboration that OCFS engages with the child care resource and referral agencies. We especially want to thank the state for increasing its investment in the important work of CCR&R statewide. We look forward to our ongoing work in partnership to increase access to quality and affordable child care for all New Yorkers. Thank you so much.
Thank you, Ramon.
So Azeda is also not present, so we're going to move right to Melissa.
Melissa Charles, looks like you're up. The floor is yours. Melissa, it looks like you're still muted if you're talking. We can't hear you. You might be on your phone, which means you need to unmute yourself. Now that you're promoted, you can unmute. There should be an unmute button at the bottom. Melissa, we still can't hear you. You might be double muted too if you're.
Yes, Melissa, if you're calling in from your phone, You are currently unmuted in the WebEx, but you may need to unmute your actual phone.
And we can't do it, right, Kathy? We can't, like,
No,
push
we've
the button.
unmuted her on our end. Would you like to come back to Melissa?
Yeah, Melissa, we're gonna come back. You may need to, the connection may not be great, so you may need to maybe hang up and dial back, and then we can absolutely get you back in line, if that's okay. I'm just gonna give her a minute, see if magic happens. Oh, okay. All right, we lost her. So we're gonna come back to Melissa, and is Joanna next? Is Joanna present?
Joanna is next.
It looks like she dropped out.
She just dropped off. I do that all the time. She probably went to hit like unmute and hung up. I do that all the time.
We'll keep an eye for both her and Melissa, and we can move to Dahlia.
Yeah, so thank you everyone for being patient too. This is what I meant about shuffling due to technology. So Dahlia had what? I don't see Dahlia.
Nope, the next person I have in attendance is Diane Abram.
Oh, good. Okay, so hold on one sec, Diane. There are call-in users, so we should verify who the call-in users are and make sure that we can hear them because we can't see who they are. So there's a 518 call-in user, and then there's a 716 call-in user from Western New York, I assume, or they were originally.
So I will, the 518 number, I will promote to a panelist.
So if you're a call-in person that starts with 518-859, can you just identify who you are so we know if you're testifying or not? And you just have to unmute and let us know your name if you want to. Okay, so maybe not that person, but also
No,
I'm going to ask.
That's me. It's Erin.
Who's me? Oh, hi,
It's Erin. Sorry, I couldn't unmute. Sorry about that.
Perfect. Okay, great. Thanks, Erin. And then call-in user number 5, which is 716697. Excuse me, if you just want to tell us who you are, that way we can know if you're on the testimony list, we can unmute you when it's time.
It's John Rothrock from home office.
Perfect. Thank you, John. Okay, so the next step, I think, is not Dahlia, or it is Dahlia?
It is Diane Abram.
Oh, Diane, great. Okay. So Diane, can you try unmuting and see if we can hear you?
Hello, hi, can you hear me?
We can, perfect.
Okay, let me try and start my video. Okay, it's not working, so maybe I have a bad hair day and I don't know that yet.
No worries, Diane, go for it, whatever you're ready.
Not working. Well, I'd like to thank you for holding this hearing today. My name is Diane Abram. I'm a group family daycare provider on Buffalo's East Side. I've been a provider for over 34 years. And I would like to thank you for providing providing paid sick time and personal and parental leave for family child care providers. I'm here today to ask you to include in section 6.1 of supporting child care workforce, item 4, subsidizing family child care provider and center-based staff retirement benefits. Many of us have provided child care to the children and families in our communities for over 25 years. I have been working in family daycare for over now 34 years. However, when I turned 65 years old in 2020, to my surprise, my Social Security benefits was only $1,100. I had no IRA accounts, no 401k, not very much savings, basically because I was among the working poor. And family daycare providers, as well as child care workers, we are among the lowest paid workers here in the country. So not only New York State, but in the country, period. What happens is that when you are low income, your wages, your Social Security is based on wages. For example, Social Security benefits, they are progressive. And what that means is that annual benefits and earnings for workers retiring at age 65, for example, in 2023, annual earning low, $29,766. The Social Security benefits was $14,824 a year, which is a monthly income of $1,235. A middle income of $66,147. Social Security benefits go up to $24,463, which gives a person a monthly income of $2,039. The annual income for the earnings for high income of $105,000. The Social Security benefits is $32,345 a year with a monthly income of $2,695. The average child care worker here in Buffalo, as of September 2023, it was $1,700 a month. So I'm sorry, not 1,700. It was 26,000 a year. So it averaged between $26,000 and $32,000 as of April 24th, 2024. So what I'd like to say is that while we're getting benefits and we're trying to bring more people into the child care field, I'm asking you to consider those of us who have worked for so many years providing high quality child care within the early child care profession, that we need help to keep us out of poverty. Right now, many of the family daycare providers that are over 65 are forced to work, pretty much till they die, actually, to tell you the truth. I'm still working. I'm 72 years old. I would have loved to retire at 65, but it was not enough income for me to survive. So I really would like for you to reconsider the portion that is talking about helping to subsidize family child care providers and staff with retirement benefits. We don't make enough money that will give us, we don't have a pension. because we're self-employed. Many of us are self-employed. And for those childcare workers that work for daycare centers, the centers don't have pension plans. We don't make enough money where we could put it into savings, and we're low income. So low income will keep us impoverished for the rest of our lives. We really and truly need your help to increase our salary so that we would get a higher Social Security benefit, and B, to help us be able to have a retirement plan by investing in our retirement for those people who have been committed all of these many years, in providing high quality child care. So I'm going to leave this question with you. The question is, would you work as a family daycare provider or a child care staff with the current wages and with the current benefits? Or would you recommend that your child or your grandchildren pursue early childhood as a career? And if not, please consider us who have been committed for so many years to provide high quality child care. Thank you so much.
Thank you, Diane. And thank you for all you do. That goes for everybody, of course.
Let's circle back to Joanna. She has rejoined the meeting.
Oh, good. Great.
Joanna, I've promoted you.
Joanna.
Tuan.
Great. Yes, Joanna, can we hear you?
Can you hear me?
Yes, we can.
Okay, sorry
Welcome.
about earlier. I'm not sure what happened.
All set. Floor is yours.
To speak tonight. One of the things that I wanted to bring up was that for daycare providers, at least in our area anyway, and pretty much federally for all 50 states, the expectations don't match the income. Everything has to come out of our pockets, be it trainings, materials, etc. So I wanted to give a testimony on behalf of myself and other daycare providers that there needs to be a consideration of providers receiving some amount of minimum wage. It's not fair that providers get paid just simply based on the amount of kids that they have. That shouldn't determine their financial performance or status. They should also be compensated for the amount of time that they've spent working as a provider. Example, the experience that they have. They also need to know that upon retirement, they have a decent amount, such as just like what the last speaker spoke about. They need to know that upon retirement, there's a decent amount and a secured retirement, because they're also teachers and educators too. They're actually the window into the world of education. Although many of them may not hold graduate degrees or undergraduate degrees, they are still that focal point, that important first step into the world of education. So they're just as important as teachers with their master's degrees and beyond. They're also required to submit a lot of documents, either on a biannual basis, monthly basis, quarterly basis. And it's honestly a lot of work, more than what DOE and private school teachers do, knowing that I have experience working in both sectors. They have teams that they can defer these administrative duties to that are on site. But yet providers are left to do this all on their own. They must pay for their own ink. They must pay for all their papers. They must pay for all of their materials. And then maybe once in a while, like, grants will come around in order to help them, which we're all extremely grateful for, but it needs to be more regulated, and they need to have some sort of current job security within their profession. It would also be, we'd also be grateful if PTO, paid time off, and reliable health insurance was also a thing. A lot of providers work day in and day out. They never take days off for mammograms, for physicals, for comprehensive blood panel tests, and they're really working their tail off. And it's really sad that they're not able to get time for themselves, so that they can continue to pour into the children that need to be poured into, but they also need to take time off for their mental health and just to recoup physically. Also, it was brought to my attention when I was speaking with a lot of other providers that they would like funds available for daycare assistance as well, because since they do not have the current financial security, they oftentimes need to come out of pocket for the assistance that they have, be it their training, their continuing education, their physicals, their fingerprinting, their background checks. A lot of these come out of the pockets of providers. So it would really be important for them to receive this sort of job security. There was another point that I wanted to make, but I believe a couple of providers have made that point as well. But basically, it would be nice, although the incentive for knowing that these kids are in good quality care is more than enough to work, it would be nice that providers are given retirement funds, health insurance, proper pay, and proper support. Thank you all so much for your time.
Thank you so much, Joanna. I meant to say this at the beginning, and I'll just reiterate it again. And at the end, make sure that for those testifying, if you could submit, make sure that you also send in your testimony in writing so that we have that too. So please, I know that was in the instructions when folks signed up, but I just want to reiterate that too. All right.
Our next speaker will be Georgette Owusu.
Oh, great. We're going to go to you in 1 sec, Georgette. Hold on 1 sec. All right. Georgette, I think the floor is yours. Can you talk so we can hear you?
Hi, good evening. I think I emailed Jared earlier. I am down with laryngitis, so I'm not able to speak. I gave a lot of my key points to Joanna to share it with you all. I do apologize. My voice is just totally gone.
Oh, no worries. No worries.
Thank
Okay,
you.
thank you. Thank you for being here, even though you can't talk. Paola is next, I think, on the list.
Hi, good evening, everyone. Thank you for this opportunity. My name is Paola Ballester. I am a childcare provider, and I would like to express that access to quality and affordable childcare is a priority and necessity for working families. Most childcare programs are small business, and due to the lack of funding, they have been forced to close their doors since they cannot afford the operating costs of running the childcare, and families cannot afford private childcare tuition. Without care, families cannot work or continue their education. We have seen the economic impact of lack of childcare during the pandemic. The lack of quality childcare is a matter that affects our community. Access to childcare supports work-life balance. It enables parents to work or pursue education. It provides a safe and nurturing environment for children and promotes child development and early learning. It also helps reduce stress and anxiety from parents. More investment is needed in the childcare industry to make the system work, to balance the system, to make sure the small providers doesn't have to close their door, and to support families' economic stability and self-sufficiency. Federal funding for the childcare industry will lead to increased economic stability, balance families' work productivity, and improve outcome for children. Thank you.
Hello and good evening. I arrived late to the presentation. My testimony is focused on applications for childcare. I expressed my concern about the slow process of enrolling children in childcare, which can result in parents losing their jobs if the applications are not processed quickly. That was all I had for now. Thank you.
All right. So just to reiterate, if people could submit their written testimonies to the email address here. They can also be faxed or mailed. Attention to Jared. All the information on the state plan is on our website. I want to thank everyone so much for being here and so much for your testimonies. Thank you, Andres, for being our interpreter tonight. Thank you to Cassie and Jared for doing the technology and the shuffling. And we're so appreciative for everyone's commitment and investment in the system. All right, thank you, everyone.